Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. House of Representatives hold meeting with healthcare practitioners on ethics and intervention in the sector. Authorities in Zamfara state say the COVID-19 vaccine is being well received in rural communities. And Denmark becomes the first country to lift all restrictions, including mask wearing. Thank you for joining us. The World Health Organization has warned that the vast amount of waste produced in tackling the COVID-19 pandemic posed a threat to human and environmental health. The tens of thousands of tons of extra medical waste had put a huge strain on healthcare waste management systems. According to the report, the extra waste is threatening human and environmental health and exposing a dire need to improve waste management practices. Now, the latest available data from 2019 suggested that 1 in 3 healthcare facilities globally did not safely manage healthcare waste. And in the 46 least developed countries, more than 2 in 3 facilities did not have a basic healthcare waste management service. The WHO said this potentially exposes health workers to needle stick injuries, burns and pathogenic microorganisms, while also impacting communities living near poorly managed landfills and waste disposal sites through contaminated air from burning waste, poor water quality, or disease-carrying pests. The report recommended practical solutions such as using the PPE more rationally, using less packaging, developing reusable PPEs, using PPEs made with biodegradable materials, investing in non-burn waste treatment technology, centralizing waste management, and investing in local PPE production. It says addressing environmental concerns does not necessitate compromising on safety. But let's now bring you the COVID-19 updates, the latest from last night from the NCDC.
158 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 10 states and the FCT. That's an increase from the figures reported earlier. Anambra accounted for the highest number of cases with 82 infections. Lagos had 35 and Akwa Ibom reported 13. Cross River came in with 7 infections, Kwara registered 6 and the FCT had 5. Other states reporting single-digit infections include Gombe, Kaduna, and Bayelsa. This report shows no cases were reported from Delta, Edo, Ekiti, Ogun, Ondo, Osun, Oyo, Rivers, and Sokoto states. There was a backlog of cases from Lagos, Anambra, and Akwa Ibom states. Nigeria now has a total of 253,181 confirmed cases of COVID-19. 296 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 229,315. There was 1 additional death recorded in the last 24 hours, increasing the number of deaths to 3,136. Currently, there are over 20,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by the FCT and Ondo State. Over 15 million Nigerians who are 18 years or above have received 1 dose of the COVID-19 vaccine, while over 5.5 million are fully vaccinated. In Africa, over 10.7 million persons have tested positive, while over 239,000 deaths have been recorded across countries on the continent. The global count of confirmed cases is over 378 million, while deaths are beyond 5.6 million.
The National Assembly is assuring Nigerians it will provide necessary intervention and funding towards strengthening the health sector to deliver effective healthcare services. Speaker of the House of Representatives, Mr. Femi Gbajabiamila, in his remarks at the closing ceremony of a 3-day training for health workers in Jos, the Plateau State capital, observes that the health sector requires intervention on issues related to industrial action by health workers and provision of infrastructure, as well as professional conduct of workers in the sector.
For 3 days, healthcare workers in Plateau State, comprising professors, medical directors of health institutions, and nurses of senior cadre, and Jos, North Central Nigeria, to ruminate on bioethics and medical laws as it affects the healthcare delivery service. The training for capacity building, which is an intervention of the Office of the Speaker of the House of Representatives, is to ensure health practitioners understand their ethical and legal responsibilities to their patients.
The aim of this training stands to initiate an attitudinal transitional process that will further bolster the service delivery of the health system in Nigeria.
The advent of COVID-19 played up the weakness of the health sector and the need for intervention.
Sometimes in life you need something like that, a shock treatment like that, to trigger what ordinarily we should have done. And it was that COVID experience that I believe triggered a lot of the interventions that the House of Representatives and my office have made in the health sector. Health reform is a cardinal part of a cardinal plank of our legislative agenda.
The president of the Nigerian Medical Association, Professor Innocent Uja, urges the National Assembly to continue the intervention program with minimal interference in medical practice in the country.
We want you to please work on issue of brain drain. That's number one. Now we find that the National Assembly is interfering with our medical practice. The foreign medical doctors that are trained, we have to maintain our standard. We do not wish any that. It doesn't matter who is involved. If you are not properly trained, you will not be released to the public to cause havoc. So please, we should be allowed our professionalism.
74 participants are attending the 3-day training, with over 5,000 health practitioners participating virtually. Similar engagements of the National Assembly have been held in Lagos and Kano states.
The Zamfara state government has taken its vaccination campaign to rural communities in Talata Mafara local government area of the state, part of its efforts to vaccinate 2 million eligible residents. The program manager, Zamfara State Emergency Routine Immunization Coordination Center, said there is no vaccine hesitancy in the rural communities visited by the team so far.
Galadima is a highly populated community in Talata Mafara local government area of Zamfara state. Residents of the community troop out en masse to receive the vaccine. The community also employs the services of local community messengers to spread vaccine awareness in the local dialect.
Seeing the severeness of the pandemic, I feel very, very happy that government consider us, send us personnel to vaccinate our people.
A resident of the community, Abdullahi Mohammed, expressed his happiness to receive the vaccine.
I'm very happy that government brought these things to our community because it is really full of protection. And we praise the government. We praise the government for their own efforts, to make people at the grassroots to be involved.
The local government health educator, Abubakar Abdullahi, attributes the large turnout to the involvement of the traditional leaders, and the program manager is satisfied with the turnout.
The secret is our traditional leaders, because we pay a courteous visit to them and they encourage their community. The community will accept their advice. That's why you see all where in Talata you can see masses vaccination. The people come out in mass bold to collect their own vaccine.
Hesitancy is not a major problem for us here, although because of the planning that we had, we engaged all the stakeholders, the traditional leaders, the political leaders, and all others who are relevant to the program.
The state just received 300,000 doses of the Pfizer COVID-19 vaccine and is expecting another batch of the Oxford AstraZeneca vaccine. In Talata Mafara local government, The team is targeting over 200,000 eligible residents to be vaccinated, and so far, about 40,000 people have received the first jab of the vaccine.
For further developments on the pandemic, joining us right now is a public health physician, Dr. Japheth Olubogi. Thank you for joining us on the program.
Thank you for having me here once again, Millicent.
All right. I mean, looking at restrictions being scrapped in some parts of, other countries around the world, do you think that we've come to a point when we can describe COVID-19 as a flu?
I don't know about a flu, but we have come to a point where we need to live with COVID-19. We need to start looking away from COVID-19 being a pandemic to it being endemic. That is, it has come to live with us in our communities. And if you see what is happening in Europe, so many countries are beginning to lift COVID-19 restrictions in their countries. And that's because they want to open up their economies. They want people to go to school well, they want people to be able to travel, they want people to be able to conduct their businesses and in a very safe environment and relaxed environment. But we are not there yet in Africa. We are not there yet in Nigeria. I dare say that we are about 8 months to 1 year away from where they are in Europe, where they will be able to lift those restrictions. And we in Nigeria, we in Africa, should begin to continue to drive vaccine acceptance so that we can reduce the hesitancy that comes with COVID vaccination.
So that means there is still the risk, the possibility of reinfection, one region, by another.
Yes, of course. If you go by what we said earlier on before we started COVID vaccination, we said that once a country is able to vaccinate up to 70 to 80% of their population, they can be described as being out of the woods because they would have achieved what we call herd immunity. But then again, we know that the virus, Omicron, can spread fast, but it is not creating so much deadly disease as the other variants. So, but in Africa, we haven't even achieved up to 30% full vaccination of our own citizenry. So we are not out of the woods yet. So we can develop a new mutagen in Africa. And once that happens, it can also infect other parts of the world. So yes, Europe, America, and some other countries that have achieved 90 or 80 to 90% of their vaccination, full vaccination, can lead restrictions. But in Africa, we should begin to drive vaccine demand so that a lot more people can be vaccinated. And it is when a lot more people are vaccinated that we can't say that we are out of the woods or we are beginning to be out of the woods. But then again, we need to continue to live with the vaccine. We need to prepare our minds to live with the vaccines. I would like a situation whereby in Nigeria, we have celebrities, pastors, we have imams, people who are celebrated, people who have large followerships to come forward and create vaccine demand, just like we are doing right now on TV and social media and everywhere. So when these influential people create vaccine demand, a lot more people will come over and take their vaccines, and then we can say that we are winning the war against COVID-19 pandemic.
We know that most countries also in Asia seem to operate an interesting model. Whenever they find a few positive cases or clusters, what they do is sort of lock down the place and then vaccinate or test everyone 48 hours, 24 hours. What do you think of that model compared to what some other countries are doing, Denmark, for example, or the United Kingdom?
Yeah, they are just trying to be careful, but we have seen that one approach does not fit all. But the best approach, I think, it's happening. It's what it does in the UK or in Europe, whereby you have people who have received 2 doses of the vaccine come forward to take a 3rd jab. Now, once you have people, a large number of people that have taken 3 jabs of the vaccines, we can say that that particular environment, that particular community, is safe for COVID vaccination, because we know that they can't get this infection, but it is not going to be deadly. So locking everybody down, trying to isolate people without vaccinating them or without pushing COVID vaccination, it's a crude method, if you ask me. We need to be driving vaccine acceptance. We need to be driving vaccination. That is what can help us win this war quickly.
Indeed, and also misinformation seems to be playing another role in that regards, but another topic for another day. Thank you so much, Dr. Jafet Olugbogbo, a public health physician, joining us on the program. Many thanks.
Thank you very much.
Well, still to come, Pfizer and BioNTech are soon to ask US regulators for emergency authorization for COVID-19 vaccine for children aged 5 and under. Please stay with us. Welcome back. As of January the 31st, 2022, 250 million people have received at least one dose of the COVID-19 vaccine, of which 211.8 million are fully vaccinated and more than 88 million people have received a COVID-19 booster dose in the United States. Well, the country has also provided free COVID-19 home tests and vaccine clinics as ways to curb the virus. These prevention methods appear to be helping with the reduction in the spread of COVID-19, but there's still more work to be done. Our Washington correspondent, Maria Byrne, has more.
The number of COVID-19 cases and hospitalizations continue to decrease for the second straight week in the U.S. The reduction in cases has many medical experts believing that we will be able to live with the virus.
I think for many people, there's been this sense of almost an anticipation or a hope that there'll be one day when COVID will be completely gone, that they'll wake up and say, okay, today there's no more COVID and yesterday there was COVID. This is very, very unlikely. It's very unlikely that we're going to be able to eliminate or even eradicate this virus. And therefore, the future, I think, is really all about how do we live with COVID, but also how do we minimize the risk, and particularly for the most vulnerable, how to protect them from COVID and its many complications.
While the U.S. still battles with high death rates, over 2,000 deaths per day as a result of COVID-19, the White House COVID-19 task force says we are still in a health crisis, but agrees that we may have to live with the virus.
It does not dominate our lives, does not prevent us to do the things that we generally do under normal existence. That would be a level of infection, but more importantly, concentrating on the severity of disease, hospitalizations and deaths that fall within the category of what we generally accept. We don't like it, but we accept it with other respiratory viruses, RSV, paraflu, and even influenza. And if the degree of immunity in the general community population, either through infection plus boosting, either vaccine plus boosting, or just vaccine alone. Those are the things that will hopefully get us to the point when we have antivirals to be able to treat people who are at high risk, that we no longer are in a situation of threat to our equanimity, threat to our economy, the threat to allow us to live a normal life.
While the U.S. has been greatly impacted by COVID-19, it appears as if scientists and medical experts are preparing for COVID-19 to be just another respiratory virus, that vaccines and antiviral drugs will be used to reduce the impact of the spread. From Washington, Maria Byrne, Channel Television News.
And Maria joins us now from Washington. Hi, Maria. Let's begin from the data from the CDC, which shows that just before COVID-19 vaccines were approved for most children, nearly 1 in 3 of over 2,000 plus children hospitalized with COVID-19 were admitted to the ICU or put on a ventilator. Are those numbers falling, as well, especially with kids 5 plus who are now eligible to be vaccinated?
We are seeing the numbers overall falling in some way with hospitalizations. Unfortunately, deaths are still lagging behind a little bit, which was expected. Now, for children, we are seeing a decline as it relates, but it's still a bit high as comparison to what it was earlier on during the pandemic. And so it is clear that children are now the most vulnerable group. And a lot of that is just due to the fact that the vaccines are not available for those under the age of 5. And so we are now seeing that children, because the Omicron variant is so transferable so quickly, children are in school and daycare environments with other children. And so that does definitely put them at a high risk.
But in terms of booster, is booster available for those 5+, or is it just for adolescents, and that would be 12 years and above?
At this time, it's just for adolescents. They have not yet seen where, obviously, there's a lot of research being done to see if those individuals over the age of 5 will be eligible for a booster, remembering that we just allowed those over the age of 5 to 12, to be able to get the vaccine as of the first part of November. So even if we go on the same methodology that was used for those individuals 12+ or adults, it would be about 6 months out before they would even be eligible for a type of booster. And so we will probably see sometime in the springtime more research and guidance in the area of boosters for the age group between 5 and 12.
Maria, you remember that at some point we were told kids couldn't get infected. Even if they did, it wouldn't be so much. And then they shifted to saying we didn't need to vaccinate kids because vaccinated adults could protect them. And now here we are. Let's talk about the vulnerable in terms of the severity of the disease. How is government and the CDC handling that group?
You know, you're correct. I mean, we saw that, we heard that very on in the beginning, kind of how children were the least vulnerable in this situation. But we know that the CDC guidance has obviously changed since then. The CDC is at this time looking to ensure that as many children that are eligible as possible get vaccinated, because they can see how the children fare if they are exposed or contract the virus with a vaccine in comparison to those that do not have the vaccine. And obviously the various variants does also play a role in how children are responding. And we know when the initial COVID-19 virus and variant was introduced back in January, February, and really in the US, we really saw the impact of March of 2020, that this was one that did not seem to have as much of an impact on children. And so the CDC is obviously putting forth mask wearing. I mean, you can see when children became the key topic and the key issue, you began to see that not only the masks were being available for free, but also the home tests are now available for free. And they're actually giving them out in the schools as well.
I was also going to ask how it works, the free COVID-19 home tests and then the vaccine clinics.
You know, the vaccine clinics have proven to be something I think that has allowed for greater access to vaccinations for all families. We know that if we get more herd immunity to the virus, that we will be able to then potentially curb. I think that they've moved away from the eradication of the virus, but more so being able to live with it at certain levels. And so these community clinics and these vaccine clinics are allowing the access and availability of the vaccinations to all individuals now that we're able to have vaccinations for free. And so they set up whether or not it's in a community building or whether or not it's even maybe in your local park where you're able to get vaccinated.
Our Washington correspondent, Maria Bird, many thanks. So Denmark has waved goodbye to face masks and health passes today as it became the first European Union country to lift all of its domestic COVID curbs despite record numbers of cases of the milder Omicron variant. Now, only a few restrictions remain in place at the country's borders for unvaccinated travellers arriving from non-Schengen countries. Here's more on the global update.
Denmark has lifted all of its domestic COVID-19 restrictions, including the wearing of face masks, making it the first European Union country to do so. Nightclubs have reopened, late-night alcohol sales have resumed, and the contact tracing app is no longer needed to enter venues. While cases are still relatively high, the authorities say the virus no longer qualifies as a critical threat. Experts say this is due to the country's high vaccination rate. Over in Italy, officials have tightened restrictions on people who are not vaccinated against COVID-19, limiting the access to an array of places and services. Italians now will need to show proof of vaccination or recent recovery from infection to enter public places. The new restrictions were put in place after the government made vaccinations mandatory for those over 50, one of very few European countries to take this step, in an attempt to ease pressure on its health service and reduce casualties. A global leader in vaccine rollout during early waves of the coronavirus, Israel's government has adopted living with COVID as its mantra since a few months before Omicron arrived. Although Omicron is causing proportionally fewer severe infections and deaths, Israel's daily caseload skyrocketed to beyond 80,000 in late January before easing back over the past few days. This is putting pressure on hospitals.
The staff is exhausted. And this is another reason that we need to be aware of. It's not like we're starting the first outbreak where everybody was full of energy. Today people are already tired. They have to wear these masks, which are very difficult to wear for hours. They have to be protected. They have to take care of very sick patients. And it's in very difficult conditions relatively, because they have to be all the time with protective gear. And for this reason, that's another reason that we need to be very attentive to our workforce and to their needs in order to support them.
And finally, the World Health Organization says the amount of waste being generated by the COVID-19 pandemic is a threat to the environment and human health. The agency says used medical equipment such as needles pose a health hazard, while the increase in plastic waste is straining waste management systems.
So the main findings is there is extra waste being generated. It's 3 to 4 times the volume of waste has been generated during the pandemic, and in facilities that aren't segregating, that number goes up to 10 times. At the same time, we know that facilities are really struggling to address this waste issue. And before the pandemic, there was 1 in 3 facilities globally that didn't have the means to segregate and safely treat waste. And this number most likely has gone up.
In its report, the WHO calls on manufacturers to use more biodegradable material and eco-friendly packaging.
Our website, channelstv.com, has more information and better updates, also understanding of the pandemic, plus other stories. Thank you for watching the program. I'm Millicent Nwaka. Stay healthy.